With me is Roy Lilley, former NHS Trust Chairman, a man who regularly helps us out on these kind of stories. Roy, good afternoon to you. It's bold. It all sounds reasonable. Nobody is disagreeing with great aspiration, but can it be done?
Well, Ian, good afternoon. A lot of it is being done. And really, I don't think the Prime Minister announced anything that was very new, or anything that was new, really, or anything the NHS wasn't doing. It's taken the number of hubs that he was talking about, which was originally a Conservative government idea. They've taken those from 79 to 140 or 180, I think it is now. So the investment is going into the hubs. They are important for two reasons. The diagnostic hubs can focus on seeing whether or not people need further treatments as inpatient care or nothing. And that's the important one. The ones that need nothing can come off the list. And of course, they do what in the NHS is called cold surgery. That means that they're ring-fenced and they only deal with waiting list customers, and they don't get disturbed by emergencies or, a smack on the motorway and they have to operate on 6 people. So, sure. I mean, they're a good idea and they work. He's talking about his deal with the private sector. Well, there's been a deal with the private sector, I don't know, going back to 2014. They can't do very much. They've only got 8,000 beds. Most of them don't have ITUs. So if something goes wrong in an operation, they have to transfer people back to the NHS. And last year, there was about 6,000 people who were transferred, most of them over 65. So, you can only kind of give them the simple stuff to do, which takes the revenues away from the NHS. And that's what, gets people excited when they say that the money going into the private sector just goes in profits and doesn't come back to the NHS. Apart from that, really, there was nothing really that was very new in it. And you have to wonder, why he dragged everybody down to Surrey to end up getting beaten up, really, by the press, who wanted to know about Elon Musk and Farage.
Yes, yeah. He sort of slightly hijacked there, didn't he, really? But I guess he should have known that does go with the territory of asking the, journalists, have you got any questions? Yeah, OK, we love the NHS idea, but let's talk about Musk, and you're absolutely right.
I must say, I felt really sorry for the parade of nurses and doctors who were sort of stage managed behind him, who started with a cheery good morning smile and ended up with a sort of grimace. And
why are we sitting here?
What am I doing here? Yeah,
absolutely. One of the big arguments against one of the points that I see raised quite a lot, Roy, from clinicians and others that have worked around the NHS, is that we simply don't have the staff. I mean, that seems to be the biggest sticking point, no matter how bold an initiative is. And you rightly said, I mean, the last government, diagnostic centres and the like, these had already been up and running. They might be putting their foot on the gas a little bit on this one, and I'm sure West Streeting is meaning well, but much of it was already in place. But without the clinical staff, without the nurses, doctors, oncologists and people who can scan and use machines, then it counts for nothing.
Well, you're right, Ian. You put your finger right on it. It's capacity. And we don't have the capacity. We don't have the capacity in beds. We don't have the capacity in staff. We don't have the capacity in kit and all the rest of it. And the reason for that goes back a long way. It goes back to the world banking crisis in 2008. After that, George Osborne, of course, was the Chancellor of the Exchequer, and we had nearly 10 years of austerity funding. The NHS got under 2% a year for nearly 10 years. So we didn't buy enough kit, didn't innovate enough, didn't train enough, didn't refurbish enough. I mean, there's a 20 billion backlog of NHS maintenance now waiting to be sorted out. And then, of course, came COVID. We forget we went into COVID with about 4.5 million people on the waiting list and about 40,000 vacancies in nursing. We came out of COVID. I mean, whatever happened in COVID, they just threw money at it. But now we've come out the other side, the chickens are coming home to roost, and the NHS is struggling with a huge waiting list. The difficulty is this: about 300,000 people join the NHS waiting list every month, and about 300,000 people get treated in the NHS every month. So you've got to, somehow or other, you've either got to stop people getting sick in the first place, or you've got to treat them quicker. Now, there is a light at the end of the tunnel. If we want to get back to the 95% of people waiting 18 months, which is Starmer's target, you can have 3 million people on the waiting list as a kind of balancing fund. The people in and the people out, and you can keep it around 3 million, and you can churn it in the target time. So that means really we've got about 4 million people that have got to come off the waiting list before we can get down to that target. Now, the NHS has done quite well, actually. I don't know why they haven't made more of it, but they've got rid of nearly all the long waiters and most of the 2-year waiters. Unfortunately, now, of course, everything's clogged up with the flu and Nova virus and all the rest of it. But given a clear run, I don't see any reason really why they shouldn't get pretty near the target. But they need a clear run, and it needs money. It's not just, paying staff. It's the overheads, the lights, the prosthesis, the gas, and, all the consumables as well cost a lot of money. So it's not cheap, but I think it could be done.